tools that we had available through businesses now directly to a consumer audience. And so what that entails essentially is a few pieces of what healthcare has to do. And I'm going to go through those with you guys. Number one is that we have a on-demand 24/7 urgent care. So acute episodic care, cough, cold, runny nose, urinary tract infections, all these sorts of things that are acute medicine, we're going to offer and have available to consumers to go in and get access to care. In addition to that, our primary care group is going to be available for virtual primary care. And what that means basically is that how you have a regular doctor that you may go see once a year, twice a year for basic things or chronic conditions, as an example, high blood pressure, diabetes, COPD, CHF, all these different types of things that you maybe see a doctor consistently for. You'll now have a doctor that can stay with you, that you can make appointments, have a relationship with, that you'll be able to now do all these sorts of encounters in an online virtual type of setting. Then what we've also done is we've layered in our specialists. So as Josh mentioned, we probably have the largest multi-specialty physician practice in, I'd say, the world, but definitely in the United States, where we have every specialty in our medical group. So that means not just primary care doctors like internal medicine, family practice, pediatrics, but we also have cardiologists, oncologists, dermatologists, psychiatrists, orthopedic surgeons, ear, nose, and throat doctors, urologists. Every specialty, both medical and surgical, are part of our group. And what that allows us to do is provide both online consults, encounters with these specialists, but also second opinions. And I think that's a big deal. That's what falls into a lot of what we're doing with the MyGuardianDoc component of this, is to really help guide patients to make sure that they're getting the right access to care, and that the care they're getting is really comprehensive and on par with what the industry looks like as far as their diseases and their disease states go. And then what we've done, so that's our medical group as a whole, kind of delivering services to these consumers. But then we've also added other parts to this. And what I mean by that is, as an example, we've got laboratory features and capabilities where if somebody needs to have blood work done, we're going to have phlebotomists go to their home, go to their work, draw blood, instead of the patient having to drive out and go sit in the laboratory to get blood work done or give samples and so forth. We've got pharmacy benefits and pharmacy components to our program, where we can get discount medications delivered to the patient's homes and those sorts of things. And there's a number of other components that we're going to start layering in as time goes by. But kind of in a nutshell, essentially what we're doing is we're giving patients access to a multi-specialty physician group that's available to them 24/7 on demand, so they can get access to care anytime, anywhere, any place. And then we're giving the ancillaries, the laboratory, the pharmacy, these sorts of things that are part of routine healthcare delivery that are part of this as well. So really at your fingertips, you have access to care. And it's something that, as mentioned, these Fortune 500, Fortune 50 companies have taken advantage of for their employees, and now we're bringing to the consumers.
MyGuardianDoc. What do you feel about that, and how do you think that it'll help people?
Well, I think it's, one of the great things, again, as people talk about the best thing since sliced bread, because the need for someone to be looking over and being readily available and able to provide some help is indeed what many people need these days, because it's become a more complex system to navigate, both for the doctor as well as for the patient. And so having a tool or like that is very much needed these days.
Okay. I'm in my car where I live most of the time. So, no, I was happy to hop in, and Marcus asked me if I could do just a brief testimonial. I think that this product is non-optional for every human being on the planet. I think the healthcare industry has been a disaster much as my own credit card industry has been. And at least y'all are moving in the right direction in terms of repairing the problem. I wish I could say the same for other industries. But I had the opportunity to try the product myself when I was in Charlotte, where I am now again. I guess it was a couple of months ago. Very much by accident, I just sort of picked up a cold, started coughing. I'm on the phone pretty much just 18 hours a day, every day, 7 days. And so the idea of my having a cough and having to excuse myself every other minute was rude and annoying. And it was, it was tough because I didn't give my body a chance to get over anything, putting it under the stress of coughing. So, I had joined because I thought it appeared to be a great product. And I thought, well, this is kind of a no-brainer for the cost. And after a couple of days of coughing, because I wasn't at home where I normally would have picked up the phone and gotten something that I was used to taking so that the cough didn't turn into bronchitis, I didn't have that available to me. So I went ahead and called. Literally within 15 minutes of calling, not only did they find me in the system, connect me with a doctor, he talked through my situation, my history of what I had taken for this previously. Felt comfortable with that he was able to call in a prescription for the same thing. I was able to go down to Harris Teeter, pick up the prescription, and start taking it. I mean, that's ridiculous. And I haven't been able to shut up about it ever since. I mean, I have just gotten on the phone with colleagues of mine, new colleagues of mine, and said, I want to tell you about something. You are flat out stupid if you don't do this. And for good or bad, people know me as being fairly candid and honest. And for me to say something like that, they knew that it had to be something that they should take a moment for. And I mean, everybody who has looked at the product has thought that it was unbelievable that something like this could be available. So that's it.
Is that you're very glad?
Well, I had the experience of my whole household having COVID in July. It was probably not the first time that we had all had COVID. And I signed up for myself personally. I had gone to see my doctor. They believed that I had COVID, but I was not testing positive for COVID. I had antibodies since 2021 for COVID. The recommendation was to go home and rest and, drink fluids. And I just felt as though I needed more care than that.
Now those prices sound right. And those services sound, just being honest, like you know, like I know, specialty copays, primary care copays, urgent care, all that stuff adds up. And being able to access those services for a reasonable fee and have, closer to immediate access than waiting 3 hours in an ER or urgent care, that's priceless to a patient, who doesn't feel well. So really interesting.
I actually found it to be spot on and excellent. We were able to meet virtually. I had my camera on, he had his camera on. I was able to tell my complete history and experience with my symptoms at present, but also that history, which, you don't always get these days. Oftentimes it feels that doctors are limited with their time. And so you have, this sort of sprint conversation in contrast to a marathon where you feel like you have to give the quick version and not the full picture. And so I absolutely feel like I was not only able but encouraged to share all of the history that I had experienced, especially as related to COVID. And I would imagine with any issue I had that it would be the same.